We are here on occupied Duwamish land, and we are mindful of that, and the Duwamish are still here, so we're grateful to be here on their land. I wanted to read a greeting from Washington State Labor Council President Larry Brown, who can't be with us tonight. And I'll just read this quickly because I think it's important to set the context. Welcome to Healthcare as a Human Rights first general meeting since the end of the legislative session. There's a lot to celebrate about this session, and I'm sorry I can't join you in person. We are especially pleased that some of our healthcare champions in the legislature are here tonight to reflect on gains that we have made and what lies ahead. The Healthcare as a Human Right campaign was convened in 2014 by the Washington State Labor Council in collaboration with several community, labor, and advocacy organizations who all believe that healthcare is a basic human right and who all understand the need to go beyond the Affordable Care Act in order to achieve universal and affordable healthcare. Healthcare as a Human Right has worked to build a grassroots movement to achieve this goal at the state and federal levels. We have also fought against the attacks on the Affordable Care Act, Medicaid, Medicare, and reproductive rights and services. This month, the State Labor Council will be discussing with some of our union affiliates directions on healthcare policy at the state and federal levels. We will then regroup with our partners in Healthcare as a Human Right to discuss how we can strengthen our common campaign for universal healthcare. This will be a key issue for the 2020 elections. If we do our work well, 2021 will be a year in which we could make dramatic gains in Washington State and Washington, D.C. Let us build the health justice movement together. And now, what I'm going to do is I'm going to send the mic all the way around the room for everybody to introduce yourselves. There are some people joining us remotely by Zoom, and they will be introducing themselves last. As we're all here to talk about, we made a lot of gains in healthcare and other areas this year in the legislature. It was kind of remarkable. And labor community alliances and coalition building and champions in the legislature are the key to all of that. And we want to keep building the movement for health justice and universal health care. Tonight there's over 40 organizations represented in this meeting, in the room and on Zoom. And there are many other organizations that we've worked with who have supported our efforts and who are not in this call tonight. Nicki Gomez here is going to talk to us about what it took to win all these things.
Hi guys, I'm Nicole Gomez. I also go by Nicki when the other Nicole is in the room. I'm co-founder and board secretary for Alliance for a Healthy Washington, also a participant in the Healthcare as a Human Right campaign steering committee, as well as the new chair for the 36th District Democrats. So the road to legislative wins, as many of you in this room know, is a long one. It tests the strength of relationships that we've built over the years, the stamina of thousands of folks committed to working towards change, and can bring the highest of highs and the lowest of lows. While we celebrate some of our victories today, we can actually never take our eyes off of what our shared long-term goals are. Our fight for progress extends far beyond the halls of Olympia, and we look forward to going back even stronger next session. So, like David said, he's asked me to give a quick overview of what it took to get where we are, starting with the 2018 elections, which brought some impressive wins that helped us move the ball further down the field on healthcare legislation. So at the national level, I want to say thanks to the efforts to people like you in this room. Dr. Kim Schreier won in Washington's 8th Congressional District, which was a very huge win. We're very excited about it, but even more so than just that, the Democrats gained control of the U.S. House of Representatives. So because of that, and because of gaining the majority, we were actually able to get hearings this year on Medicare for All for the first time ever. So that's pretty exciting news, and I want to say thank you to everybody who helped on that. At the state level, progressives expanded their majority in the Senate and in the House. So campaigns and their volunteers were able to secure wins in 5 key battleground seats. Marco Elias in the 21st, Emily Randall in the 26th, Claire Wilson in the 30th, Steve Hobbs in the 44th, and Menka Dhingra in the 45th. So these senators will serve through 2022, and they're also going to play a really important role in Washington's redistricting process. So that being said, elections matter. Who here has volunteered on a campaign before? Raise your hand. I'm not shocked, actually. So thank you to everyone who has volunteered. And it's actually folks like you that help win these elections, and I know that's why you do it. So again, thank you very much for that. So what happens after election night? A lot of work goes on behind the scenes leading up to session. So ideas to change, amend, or create a law are presented to our legislators. The coalition building and community labor alliances resume or begin to form in some capacity. People identify who they should partner with in order to achieve their next goal, and work towards building those other relationships that are needed. So organizations actually start training their members on how to become more civically engaged, and that way when the time comes, those members are ready to quickly mobilize. So once session starts, we actually educate the members of our respective organizations so that they know what bills to watch and what bills to support. From there, the advocacy or lobbying work begins full force. That includes visiting Olympia in person, participating in meetings and calls with our allies, working with committee chairs and getting letters of support from individuals, advocacy organizations, and businesses, organizing action alerts such as phone calls or emails to our legislators. Our legislators and their staff actually work closely to consider the needs of all stakeholders as well as their constituents. So they spend very long days working on bills they hope to see passed as law. They receive copious amounts of emails, texts, phone calls, and have meetings set back to back. If you've ever worked for or have ever been a representative or a senator during session, you know how exhausting that can actually be. So today I just wanted to say thank you very much to our legislators here and all of those for your dedication and hard work. So, boots on the ground, or grassroots mobilization, is actually the key to advancing legislation. Each email and phone call is tracked so that our legislators know where their constituents stand on an issue, so that they can let their colleagues know exactly how many people in their district want a specific bill to pass. And more importantly, though, are those stories. They need these stories, that way they can connect the individual impact of the proposed legislation. If you've ever shared a personal story with your representative, thank you. It's not an easy task to do. So I was asked to take kind of a quick pulse of the room tonight, and if you're able to raise your hand when I ask, and just keep your hand up for a little bit, and bear with me. So who here today wrote a letter to your legislator? And keep, just this past session. Keep your hand up if you've also called your legislators, or raise your hand. If you testified at a committee hearing, and if you went to lobby in person. So I'm looking at almost everybody in the room has raised their hand, and that is awesome. So a big round of applause to everyone in here for all your hard work. And thank you for your commitment to making your community a better place. And without folks like you, the wins that we are going to talk about here tonight could not have happened. So that being said, the next person on the agenda is Marcia Stedman, Healthcare for All Washington, and I'll let her tell you what she's talking about.
Thank you, Nicki. Actually, I'm going to tell them what you're talking about and what everyone did this session to take us further on the road toward the pathway to universal health care. This bill made history this year in many ways. From the bill's opening comment statement to its passage in the Senate, to the bipartisan support in key House committees, and to the final Hail Mary pass, which was instead of a bill passing in the House, on the House floor, we were able to get a budget proviso in the House budget, allowing for a $500,000 funding to fund the actuarial and economic analyses that are so crucial to convincing people that we can do this in Washington State. And this also, so to go back, the bill's opening statement. The legislature finds that health care is a human right, and it is in the public interest that all residents have access to health care. This is huge. This is possibly a historic first time that a bill is passed and in a chamber of any legislature with this statement in it. So in the Senate, the bill did pass, and we're so grateful for the work of David Frockt, Senator Frockt, and Senator Hasagawa, who worked with constituents and lobbyists for the Pathway bill, and and of course, well, for Senator Randall for introducing it. Sorry, sorry, let me back up. I need to back up more. So Senator Randall got important help from Representative Macri. It was a collaborative effort as far as I could see, because I loved seeing your dual testimony. You were a panel in the Senate, I believe it was, right? In the Senate Healthcare Committee. So that was really, really great and fun to see and hear your personal stories as well. It really personalized the whole issue for all of us. We knew that we were in this fight together, and it really meant a lot to us and the entire effort. So from the historic bill that was actually developed with the help of Healthcare for All Washington, it's very instrumental help, and including amendments that were suggested by one of our board members, Hal Stockbridge, that, and the testimony that we were able to give to convince the Senate Ways and Means Committee people, including Senator Frockt, especially to actually get those amendments into the bill. And then I could go on too long, so I will stop a little bit. I could tell you more later. If you want to know, ask me. So we also heard a lot of good testimony on the Senate floor from our healthcare champions like Senator Cleveland and Senator Kuderer. Very huge proponents for our bill. Now, the bipartisan support in the House committees, we had one member, Paul Harris, from Vancouver in the Healthcare and Wellness Committee, who voted to move the bill forward to appropriations. Yay. And in appropriations, we had the vote of Mike Steele from Chelan, who voted to move the bill forward to the Rules Committee. Yay, thanks, Representative Steele. So that's historic. And then in the legislators ran and won on health care, and the voters held them accountable. Thanks for all that you do, voters, because what you did, voters, helped them, the legislators, to deliver on their promises. So together it was a collaborative win-win effort. So the Pathway Bill is number one on healthcare as a human rights legislative agenda, and we're really, really pleased about its success. The governor's Cascade Care bill, I put in a plug here for that bill because that's an important bill too. That bill was not on the legislative agenda of healthcare as a human right, but it was on the agendas of many of our healthcare as a human right coalition partners who actively supported the bill and testified in support of the bill and its goals, which are to provide more affordable health coverage to individuals purchasing health insurance on the exchange, and to plan for future premium subsidies for those whose incomes are less than 500% of the federal poverty level, and with a goal to spend less than 10% income on premiums. So this is something that can be put into place with the current system we have now. So the final bill that emerged from conference passed both chambers easily and has now been signed into law. So that's the governor's bill, and that was a big win too for what we can do right now. I would say that it's, just to wrap up, it's worth noting that some of the final bill's provisions could serve as stepping stones toward more affordable health care for all. And I was really pleased to read that when I was looking at the bill last week. So the provisions that I'm referring to are the provision that the plans are standardized. All health insurance carriers participating in this segment of the exchange must offer the same benefits. That's kind of like the Medicare regulated plans, so that idea, so that's a plus. The reimbursement rates to providers are capped at anywhere from 101% to 160% of Medicare rates again. There's a public notice and comment period put in place for every year annually before the plans are finalized. So that allows for public comment. And they're going to study the impact of offering only standardized plans on the exchange in future. So this points to a direction for further work to be done in order to provide health care for all residents of Washington State. So thank you.
Next up, we have Margaret Carey, who's going to be talking about surprise billing.
Thank you. So I think it comes as no surprise to many of us in this room that 2/3 of bankruptcies are due to medical debt. And that's just a travesty and probably one of the reasons we're here. And most often that affects low and moderate income working families. So one of the reasons we're celebrating the surprise billing, the passage of legislation that protects consumers and patients against surprise billing, is because it is one step further to dealing with this issue that's really a huge issue for a lot of people. And what happens if you get a really high bill in the mail is, if you don't pay it, because maybe it is wrong, right? Sometimes and very often, if you don't know the system, you may decide not to pay and you end up in court and you incur attorney's fees, et cetera. So it's a very bad situation. So what is this surprise billing legislation? Some of you might have heard about it already. What this does is protect consumers and patients from being billed for out-of-network care during an emergency hospitalization, or when receiving care at a facility within an insurance plan's network. What happens is a lot of facilities, whether it's inpatient or outpatient, hire per diem independent contractor providers who are not in the network. So if you have a surgery and you have an anesthesiologist who is not in network, you can easily get, right? You get an out-of-network rate, which is a huge rate, a bill in the mail. Similarly, you might have radiology expenses. You might have a surgeon or a hospitalist who is also out of network. It's very common. And this is why the insurance commissioner actually spearheaded legislation. And then thanks to our legislators, they picked up the baton and sponsored this legislation that protects consumers. So what happens is you get that out-of-network provider, but you will not get a bill that's an out-of-network rate. You get the in-network rate. And what happens is, and this is per the insurance commissioner's original intent, it puts the dispute squarely between the provider and the insurance carrier rather than the patient and consumer. So this avoids, it seems like to some of us a small issue, but in the world of people's paying bills and families making, living check to check or however it is, it's a huge deal. So I'm very excited, and thanks to everyone for what all of you have done to put this legislation to a success. Anybody here testify or email on this particular legislation? Yeah. Thanks to all of you. I think having all of us in the room is real testimony to what it takes to win these fights, to pass this legislation. And thanks to the legislators for, doing the hard work that it takes to put, we know there are long hours involved. So,
Thank you. Next up, we'll have Sybill Hyppolite, who's going to be talking about drug price transparency and clean breaks. She's from SCIU 1199.
Okay, so I will start with the breaks bill. So at 1199, a number of our members are nurses. Nurses, as you all know, can work really long, tiring shifts. And there have been protections in place for nurses to be able to get breaks, which makes sense when you're taking care of patients for a long time. You should be able to have time to go to the bathroom or get a meal or something like that. Unfortunately, the way that a lot of hospitals were interpreting it, they were making sure someone could take a 15-minute break, but it could be broken up into many times. So you could say, hey, I'm about to go take my break, and they would say, no, you can't. I saw you go to the bathroom earlier. I saw you take a call from your child. If you add all those things together, you already got your break. So, which is ridiculous and puts patients' lives in danger. You don't want someone taking care of you who hasn't had a break in 7 hours or 12 hours. So we've been working on this for many years, and we're able to finally pass a bill that makes sure that people can get an uninterrupted break during their shift. So this is a huge victory. It will impact people all across Washington. So we're really excited. Another bill that we worked on was prescription drug price transparency. I can't say it either. Basically, as we all know, the prices of drugs keep going up and up and up. One of the examples that many of us are familiar with are EpiPens, where the prices went up really unexpectedly, really for no reason besides profit. And so we managed to pass with support from this coalition. There were many letters and emails that came from you all, so thank you so much for your work. And we're able to pass a bill that for the first time in our state requires drug corporations to justify the prices that they're charging patients. And insurers will also report what they're seeing in the area of prescription drugs, and a report will be provided to the public on what exactly is going on. So we're really excited about this. It creates a building block to be able to actually hold these drug corporations accountable. So thank you again for everyone's work on that.
And next we're going to hear from Janet Varin from Northwest Health Law Advocates, and she's going to be talking about the larger wins for the community and labor agenda, and a little bit more about immigrants and American Indians.
So as far as healthcare is concerned, it has been a banner year. It's just step by step toward healthcare as a human right. And if you want more information, they are on our website, nohla.org. And we have also blogged on some of these bills for more information. So first, I'll just mention that there was, I think, a groundbreaking effort to protect the state from the erosion of the Affordable Care Act and other health and equity provisions through a bill that actually incorporates some key provisions from the ACA into state law, which means that now our state has its own basis for protecting individuals with pre-existing conditions and those needing care from discrimination by insurers. So, great way to hold the line. Make things better than the Affordable Care Act. So we also had the Reproductive Health Care for All bill that enhances equity by prohibiting discrimination that many transgender and gender non-conforming people face in receiving reproductive health care services, including a requirement. There are a number of great requirements in here, but it includes a requirement that there be clinical recommendations around improving reproductive health care for people of color, immigrants, refugees, gender-based violence survivors, and people with disabilities. Then in the area of low-income programs, Medicaid, also known as Apple Health, and actually some of these are not permitted by Medicaid, so now funded through the state. There's an expansion of family planning coverage to immigrants. It's sometimes known as the Take Charge Look-alike program, because we have a program called Take Charge for people who are citizens and certain qualified categories, quote qualified, categories of immigrants for reproductive health services through Take Charge. That's a Medicaid program. This would provide exactly the same coverage for people who are not eligible because of immigration status for Medicaid. We also have a bill to remove barriers to health care for workers with disabilities. This is a form of Medicaid coverage, and this is to address a problem of individuals who are trying to work at maximum capacity, but they hit an income level that would disqualify them if they worked more. So this would relax the income and resource limit requirements. There's also coverage being added for dental for many low-income immigrants who don't qualify for Medicaid. Basically, two categories. Those who get a program that's state-funded called Medical Care Services for people who are either incapacitated from working or over age 65, and also people who are citizens of the COFA Pacific Island nations of Micronesia, the Marshall Islands, and Palau. They qualify for qualified health plans in exchange, but they don't get, and there's actually some wraparound coverage for them that passed last year, but that did not include medical, and now it will as of 2021. There's a Washington Indian Health Improvement Act that establishes the Governor's Indian Health Advisory Council to adopt a biennial Indian Health Improvement Advisory Plan and address policies or actions that have tribal implications that are not able to be resolved or addressed at the agency level, and provide some oversight of certain services. And then finally, and this is not at all final, as you'll see if you look at this chart, but it's, I just had to select a few. There's a bill to create and this is a first in the nation program to pay for long-term services and supports. And I know a number of groups here were active in that, as well as in all these other bills. And the idea is it's a form of insurance that Washington workers pay for with payroll deductions starting in 2022. And then if you pay in for at least a certain period of time, you get benefits for to help pay for long-term services, for example, care provided in your home. That is just a very exciting new opportunity. Happy to bear all this good news and to look at so many people around the table who are actively involved in putting these forward. So read up, and also realize that these are steps along the way. We need to keep up the momentum. There's much that remains to be done. And I'm proud to say that our organization has been at it for 20 years, so I was allowed to give a little plug. We're having a celebration on Friday evening, so tickets are still available.
This meeting is about like celebrating, so I want to make that like really clear. My favorite part of my work is the people I work with, and I get to see all the people who actually like show up for it. That's what I get to see every day, and I love it, and I want to thank everybody here, and I want to make that like really clear. Before I like start highlighting stuff, it's like, oh darn it. So yeah, Janet brought your attention to these great handouts, and the first one on the budget side, there's two of them. The first one highlights that the Healthcare Authority is $350 million short in its budget this year, or going forward, I should say, based on this budget we just finalized. It's $350 million short because the legislature has found or finds that there's going to be $350 million in savings based on program integrity measures, based on like fraud prevention. Now, I invite you to read more about that. I don't want to take too much time, spend too much time on that. However, I bring it to your attention because what we are hearing from the Healthcare Authority is they don't think that those savings will be realized, and when they are not realized, the Healthcare Authority is going to have to turn around and ask the legislature kindly to fill in those gaps. And I bring that to something I want to talk about in my Washington Can capacity, but also just to bring more attention to this overall. I think most people in this room understand that Washington State has a very regressive tax structure. I think people need to keep the presence of mind that a regressive tax structure perpetuates income inequality. And if you look all around the state, income inequality is right in your face, especially here in Seattle, so and in this region. So when we talk about any kind of budget fight moving forward, we really need to keep the presence of mind about more progressive forms of taxation and revenue. Let's not be shy about closing tax loopholes. Let's not be shy about capital gains. Let's win on that. And let's not be shy about an income tax. We need to educate the people that we work with so that they understand that an income tax is actually a good thing. There are so many people that are reflexively like, oh, it's a bad thing, but they don't actually understand that it would mean more money in their pocket and a more progressive tax structure and then we wouldn't have to have these annual budget fights over healthcare. And every other issue we care about, because we have people at this table that do amazing work in other capacities, and the things they're fighting for need funding as well. So I just wanted to highlight that and really say, and then one last thing, we have a 4-to-3 ratio in majorities in our state, in both houses. Our champions are sitting with us, and they're going to fight for you, and they're going to fight for us. But we do need to do our homework and find those fence sitters who are scared to take these votes on progressive taxation and hold them accountable, make sure they're getting those letters, calls, emails, and personal stories so that they can come around and come home and make our state like a lot more progressive. So thank you very much, everybody.
Also, let me announce, on July 10, Wednesday, July 10, in this room, we're going to have our next general meeting, and it's going to be a brainstorming session on policy directions for our Healthcare is Human Right campaign over the next couple of years and going into the 2020 elections. And we'll get updates on what's going on at the state level with the Pathway to Universal Healthcare Workgroup, with Medicare for All, with other bills at the federal level, but we will be brainstorming on what makes the most sense for us as a campaign to prioritize. And so you'll get a notice of that if you're on the sign-in sheet. And here, Bevan.
Okay, so I get to be the fun person that does the moderating, as it were, with our legislators, and I think a lot of folks are excited to hear from all three of you. So I will say that as our legislators are talking, if you think of a question that you would like to bring up, please write it down. And I want to make sure that everybody gets a chance to ask the question that they want, so make sure it's, concise and it's a question, so that we can all get a chance to hear the answer from the legislators, right? So, but first of all, I want to say thank you to all three of you so much. I really have felt the honor of working with every single one of you these last couple of years. So thank you for everything you've done, and I would love to hear, I think we all would love to hear, if you prime sponsored one of the bills that were talked about earlier, please let us know. Not everybody knows exactly what you prime sponsored, so thank you in advance for all that. So we're going to give each one of you guys 5 minutes, and Nicki has set up a timer over there. You can just look and get a sense of where we are. And please just let us know, some session highlights. I don't know, maybe Senator Randall, well, actually from all of you, how do we make the Pathway Workgroup be a strong work group and get the results that we're all hoping for? And maybe some hopes for next session, and how did things go for you all? So who would like to start?
Thank you. This is a great overview, so thanks a lot. Again, I'm Nicole Macri from the 43rd District, Vice Chair of the House Healthcare and Wellness Committee, and I sit on Finance and Appropriations, to Ethan's point about progressive revenue. So highlights for me really started long before session started. I actually worked with many people in this room and really closely with Senator Frockt on a strategy around pushing the agenda around universal health care. So building on the work that we did last session, we were able to get funded a study in the 2018 budget to look at universal health care models. And in fact, the report from WISP on that just came out the end of last week. And I think highlights what we all already know and helps to push the agenda around the need for universal health care and some of the challenges that we know we have in the U.S. healthcare system, including the fact that we don't have a fee schedule for providers, including that through huge mergers and acquisitions of hospitals, we've seen hospital cost inflation just insanely high over the years. And the private market profit motivation that is built into our market-based system. And so lots of good fodder in that report for us to bring forward in the Universal Healthcare Work Group, as well as our legislative strategy for next session and beyond. So I'm really, really grateful. I'll say people in this room were incredibly patient with me as we worked through a strategy. And it was a deliberate strategy to really try to get some wins that we could build on and that we can continue to push our colleagues in the legislature on these issues. So I prime sponsored the Pathway to Universal Healthcare bill in the House. I also prime sponsored the Reproductive Health Access for All bill. You might know, you're going to notice a theme here. I also introduced the expanding Apple Health Care to age 26, which I know is a priority of this coalition that did not pass, but that we will continue to push on. And I think the work that we did in the RHAA, the Reproductive Health Access for All, expanding services for undocumented immigrant families through that bill gives us a stepping stone to continue that work on expanding Apple Health. The big highlights around healthcare really were the bills that you had heard about, plus the big budget investments we made primarily in behavioral health. A lot in hospital, we have a lot to do with our in terms of fixing our state psychiatric hospitals, but we also put massive new investments in community-based behavioral health, which was huge. I will say that is somewhat balanced out by these quote. I love the quote savings as the is in the matrix on the physical healthcare side of HCA and the Medicaid system. So we're going to have to track that, and I do think it's concerning to me as well. But the investments in behavioral health were really historic, and I think we're going to see returns on those investments in a pretty short period of time. And so you hit on the big highlights, the prescription drug transparency, surprise billing. The long-term care trust is huge. It is the biggest expansion in social insurance that we have seen in forever. It is going to be over $1 billion a year in investment in long-term care. I gave a speech on the House floor about the long-term care struggles my own family is going through right now. With my partner's dad, I know every single person in here has some story or knows of somebody who's gone through it, so it's going to be huge. The things I'm looking forward to is working on hospital finance transparency measures, building on the work we've done on prescription drug transparency. I think we really need to look at hospital systems, get more more of a view in there. Continuing to work on the Apple Health to age 26, and also working on the Protecting Patient Care bill, which is also related to the impact of mergers and acquisitions, the prevalence of Catholic hospitals, blocking access to the full range of reproductive health care and end-of-life care. So I'm excited to work on all of those things next year. And between now and next session, really excited to be working on the Universal Health Care work group.
Not sure I can really add much after you all gave such really comprehensive updates on the work that we did. We know that, I, especially as a new member, had the great privilege to come in to a coalition that had been working so incredibly hard on healthcare for such a long time, and to work alongside great mentors and colleagues like Nicole and David to dig in and make incredible progress this year. So I still feel like on a high after this session, and I've been visiting middle schools and high schools and community colleges and talking to students about the legislative process, what it was like to be a first-year member, and what I'm most proud of. And so many students and their teachers have been asking about our work in healthcare. Today we used the Universal Healthcare Workgroup bill as kind of a case study for how bills get introduced and move through one chamber, and how it can look so different in the other chamber, how things can get stuck, but how you can problem solve and come up with another creative solution. And I was just really honored to get the chance to work alongside all of you and along my partner in advocacy and access. As Nicole mentioned, we did a lot of work together this year, and I couldn't have envisioned a better first year. Some of the bills that I sponsored included the Pathway to Universal Health Care in the Senate, the Reproductive Health Access for All Act, the companion to Representative Cody's Medicaid buy-in for workers with disabilities to ensure that folks aren't limited by an income cap, and that folks are able to keep protected one savings account. Because up until now, folks have worried about accumulating any assets. How can you save for a rainy day if your savings account puts you at risk of losing your health care? So those are some of the healthcare bills that I have the chance to spearhead this year, along with another bill that's on this list, hospital notification of sexual assault kits. That was my seatmate's bill, Michelle Caldier, and she also championed our work in hospital mergers and acquisitions, requiring hospitals to give notice when they're making those plans, especially because in Kitsap County, we have really experienced the struggles of Catholic hospitals merging and getting bigger and bigger and taking up such space in our healthcare arena, so that folks are not able to get particularly the reproductive and end-of-life care that they depend on. I'll talk a little bit about the Reproductive Health Access for All bill, which also went through quite a transformation. I know some of you tracked it really closely, and we had, some frustration when we were able to pass the bill as written through the Senate, and then House leadership didn't want to include part of the bill, the part to create that Take Charge lookalike program to extend preventative reproductive health care, family planning services to our undocumented neighbors, folks who didn't qualify. But because we had such a strong coalition, because all of you were engaged, because we had other, neighbors and advocates who were committed to change making and problem solving, and because Representative Macri is full of great ideas, we were able to work on bringing some of the other reproductive health care bills that had been stuck in the process into this bill to make it stronger and richer and to cover more people and make sure that, like with the universal healthcare bill, we got that Take Charge Lookalike program funded in the budget. So while at first it felt like the sky was falling, we were able to celebrate such an enormous victory for Washington residents this year, which only feels more powerful as we see the Trump administration, removing protections from our transgender neighbors, continuing to take hits on reproductive health care around the country. This work is important, and we in Washington are not just playing defense, we are continuing to extend care to folks who need it most. So that was really I think I just hit my 5 minutes.
Thank you. Thank you again for having me here today. The first thing, before I get into my comments, first of all, the shot clock is very cool. That's like I wouldn't figure out where they get that program. It's an NBA shot clock. It's very cool. How many votes were cast in your election total?
Oh, a lot.
Like 80,000, something like that?
Yeah, almost 80,000.
Almost 80,000. How many did you win by?
101.
So the point I want to make is that when you think about what an incredible progressive champion who did amazing things as a freshman on healthcare, what 100 votes, it's less than a vote per, and there's probably, 500 precincts or something, I don't know how many there are, less than a vote per precinct. We got Emily Randall in a very tough district. This is a brave politician right here. But we talked about it, and we were trying to. I had a lot going on with the budget and the Cascade care, and so we talked about it. Emily just was gracious enough and took the lead on the Pathways bill that we got through the Senate. How weird is it that the Senate is more progressive on healthcare than the House right now? I don't know what's going on there. We've got to change there. But in the end, it all worked out. So, and not to Nicole's detriment. It's just politics are strange sometimes. But I remember I said to Emily, "Are you comfortable taking on this idea of a pathway to a universal system?" And she said yes, because it's the right thing to do, and it's because I know when I explain to my constituents, they can understand what I'm getting at, and I think it was great. And you guys should have seen her on the Senate floor when we debated that bill. It was the last bill of the first cutoff period, and we knew we were going to have a knockdown, drag-out fight with the Republicans. It was about a 2-hour debate, and we had a lot of fun. And we won the debate. And so, the other point I want to say is that before I talk about Cascade Care, the ACA protections bill is incredibly important. I mean, we have right now the administration, people are saying they're going to lose this case where they're trying to overturn the ACA in full. I don't know about you, they've got Kavanaugh and Gorsuch on the court now. Who knows what Roberts is going to do? I mean, we're depending on John Roberts again, and who knows what he's going to do this time to maintain this thing. And so the fact that we enshrined it in law is incredibly important. It was an incredibly significant bill. And one anecdote from the debate, our friends on the other side, we had the bill, and they thought they were going to be really cute by half, and so they had an amendment to strip everything out of the bill except the pre-existing conditions. And they were going to say, well, the only thing we're going to do, what they were trying to do is to hang out the Democrats, because they knew we couldn't accept an amendment that took everything else out of the bill except pre-existing conditions. So then they would be able to go put on a flyer that Democrats voted against protecting pre-existing conditions. It was a ridiculous amendment. So this is politics. This is what happens. So we stood up on the floor, and I remember I stood up and I said, well, let me just get this right. Under this amendment, the lifetime caps are gone. So if you vote for this amendment, which is your amendment, you're voting to put people into bankruptcy who have cancer. Is that what you want to do? And then everybody else is ready. You can see them, they were all looking around. Wait, whose idea was this amendment? And they had already asked for a recorded vote. So as it turns out, they thought they were going to be real cute by half, and almost all of them took off, and they all voted against their own amendment at the end because they didn't want to be on record. So it was a very interesting debate. Which leads me to a general point that I would say is that I feel like, on our side of the aisle, the momentum on healthcare for what the people want is in the direction that this group and these groups are pushing. Okay, we're on the right side of history. We're moving in the right direction. We're going to get there. It's going to be fits and starts. It's not perfect. There's different plans out there that the presidential candidates are advocating for. But I don't think there's any question that the people understand that we need a more aggressive role by the government in healthcare to make it work better for all the people. And that's what our bills were about this year. So I sponsored a number of them. Cascade Care was one of them. I did the medical debt bill. I was the prime sponsor in the Senate, although it was a House bill that passed. One of the behavioral health facilities bill. I worked extensively on that in the budget and also was the prime sponsor of that bill. And then I also did one that was listed was the de-escalation bill. That was something I've worked on for many years. So I'm very proud of that work. On Cascade Care, I'll just wrap up very quickly, and I'm sure we'll have some Q&A about it. I think that the key things to take away is that the standardized plans are incredibly important. The fact that we are taking a step to actually address provider reimbursements. The bill was originally based on Medicare rates. We had to go up to get the bill through. Now, I know there's been some concern that it's not a true public option in the sense that insurance companies are still involved, and I get that. I heard that criticism, and so I've been trying to be more careful at describing what the bill does. I think it's an important bill. Governor Inslee is campaigning and saying it's a public option, so I mean it's okay. I mean it's just semantics, but the important parts of the bill is that the government is setting the terms of the plans and the reimbursement rates, and if we're going to get to a universal system at some point, either state or nationally, we're going to have to basically have some way to have the reimbursements and provider rates set, and that was the most controversial part of the bill. Candidly, I was pretty disappointed in our state medical association. We did have the support in the end of the family physicians, but the state medical association was very, 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 very hard on this bill. The hospitals we knew would be opposed to it because there was a Rand Corporation study that just came out. Even some of you may have seen the story in the New York Times about 2 weeks ago on this. Some of these services that are being provided are being compensated under the contracts they have with insurers at 300 or 400, sometimes 500% of Medicare. Okay, so we have to find a way to intervene to put some downward pressure on our costs in the system, and I think that's what's significant about the bill, and I think that's why they fought so hard against it and why it's still controversial. So we still have more work to do, but I think it was a significant piece of legislation. I really appreciate the fact that many people in this group came around and were willing to support this in the end, because I think there'll be things in this bill that we will take as our system advances in the future, and I think that's really important. So thank you very much. I look forward to your questions.
I'm going to start because I have the microphone. So I have the pleasure of working with both Senator Randall and Representative Macri on this amazing pathway to universal health care, and doing our kind of gymnastics to get it through at the very last second of the last week. So would love to hear from either both of you or one of you or whoever, how do we make this work group the most effective that we can? What do you need really kind of from the outside to help make it effective? I guess I'll leave that there.
No, go ahead.
Okay, I'll start. So I'll give a little bit of an update of where we are right now with that work group, and then we can talk a little bit about how folks in this room and otherwise can be helpful. Under the budget proviso, the Healthcare Authority is convening this work group. The director of the Healthcare Authority, Sue Birch, will chair the group. So that I think is a good sign that they are taking the work very seriously and putting their leadership in charge of that. I think that's a direct result of the work of folks in this room, including pretty good media coverage of the bill as it went through the legislature. And so HCA is attuned to the fact that this is a high-profile work group, and they want as they told me, to take it very seriously. They don't want it just to be a make work group. They really want to see results, and they are interested in bringing sort of divergent stakeholders to the table. They're just beginning their outreach to different stakeholders. A couple of you may have heard from HCA. They're going through some formal channels, so they're going to be sending out letters to kind of establish stakeholder groups. So the Labor Council, the Medicaid, managed care, health plans, the Association for Washington Health Plans, which is kind of the private insurance health plans. They're reaching out to patient advocate groups, the legislative caucuses, and others. They're intending for it to be a pretty transparent and public process. They think it'll kick off in August. They'll probably have meetings about every other month through October 2020. They are right now ballparking probably 25 participants in the work group based on the stakeholder categories that were named in the proviso that came out of the bill. And they will have in addition to the outreach they're doing, they will have a public application process as well that they'll probably launch in the next few weeks. So they're planning to have a standing website where materials will be posted. They are going to have public meetings, as I said, every other month, and they'll have public comment as a part of that. They'll be presumably available on TVW, and they're right now just starting the process of drafting an RFP to contract for the financial analysis study. So they're starting work. Usually the agencies don't really start work, and they didn't until the budget is signed by the governor. That just happened a week or so ago, and so they're just really beginning the work, but their sense is they're taking it pretty seriously. So Sean O'Neill is the HCA's legislative liaison. He also will be the lead project manager on this, so he'll be staffing the committee on behalf of the agency. He said one area, I talked to him about something that I talked with several of you about, and is I think part of the Hasagawa-Frockt amendment that got hung in the Senate, which was to ensure that we really had the voices of consumers in the work group, including folks who are underinsured or uninsured, who are like not in at all, and who need coverage or need better access. And so, they don't have a natural network, right? So want your input on a good representative voice for people who are totally uncovered, lack the access to care that they need, or are underinsured. So that's one thing we can ask for. And then to make it work, I think, show up, I would encourage any group who has thoughts about the work group before it gets stood up to do that. Senator Randall and I have been talking about, and I have a request out to HCA that we maybe do a pre-kickoff gathering to give them some stakeholder input. So we may try to organize that before August as one strategy to help inform the process. So I think we're taking it very seriously, and I was encouraged to hear that HCA is taking it very seriously. The comment I got from them was that they think this is something, this is the direction we need to be talking about, and they're very interested in doing the work well. So, yeah.
The only thing that I will add that we sort of talked about before is that media attention that is kind of driving some of the HCA's commitment to this work is in large part because of your advocacy, and I know Bevan played a big role in creating that interest, and I would say don't slow down. Yeah. We want to keep the pressure on because we want the public and everyone involved in the group and the HCA to understand that the community is behind us and that everyone in Washington needs and deserves the best work that we can give so that we can have a clear direction moving out of the end of the work period. So I'm really looking forward to continuing to collaborate, and if there's an opportunity for a pre-August stakeholder group, I hope that many of you will be able to join us.
Thank you so very much. I just want to suggest and recommend that we not leave out any part of our state. We tend to think West Coast, and that's not really fair, and the needs of the rest of the state is very different from one corner to the other and in the middle. So what I would suggest about stakeholders is considering organizations like SEIU, like Washington Community Action Network, and the resources that they have and the on-the-ground people who are needy right there. So
I have a question about the Pathway bill, and I just think it was a fascinating maneuvering where it sort of failed but in reality passed. So I'm curious about what do you think the key arguments are that we have a chance in persuading some of the other legislators, particularly in the House, that were against it? And not the ones that are like dead set, they'll never be convinced, but what are some arguments or some hesitations really that you were hearing from some potentially persuadable people that we could work on?
I love my caucus. So I will say, I think this was part of the strategy work that we did in the interim, right? We really debated whether or not this was the right approach. It is an incremental approach, and there is a question about whether or not a work group creates a report that will be shelved or really is a mechanism to move change. And so I think that is a point of sort of debate amongst legislators about is there value to doing a convening like this, or should we just focus on policy that we can move? And the challenge we have is, so we have introduced over time, I know Senator Frockt has over time introduced universal health care bills, and they have not gotten very far in the legislature. And so this was a deliberate strategy, somewhat built off of lessons learned from other states and what they're doing now in this time of attacks on the ACA, and seeing and really living out some of the shortcomings of the ACA about what's the strategy that moves forward at the state level as we all continue to work at the federal level for truly universal care. And so I think helping lawmakers understand what the value of a state level strategy, I think that's a point of debate amongst our colleagues. I hear from a lot of folks, well, we just need to push at the federal level. There's really not much we can do at the state level. I don't believe that to be true. I think any major social change that we have seen in this country at the national level has always started at the local and state level. While we certainly are hamstrung by some of the federal resources and regulations around healthcare, there's lots of innovations, cost containment strategies, and expansion of access and coverage that we can do at the state level. And so I think making sure lawmakers sort of understand that. I think a lot of folks who aren't deep into healthcare policy, they just hear the little sound bites and they don't know really what is possible. So the work that you all do to reach out to your individual legislators helps tremendously there. We actually got a lot of support. So I think there's hope. I'm feeling hopeful.
The only thing that I would add is, I know we did work on this, with Bevan and with the coalition to make sure that we had representation from weak vote districts. The folks that we were trying to flip, we wanted to make sure that they were hearing from their constituents, and that is a message that was really hammered into my brain while I was working at Planned Parenthood. You know, no one turns out constituents like Planned Parenthood votes. You know, we've seen that with Lisa Murkowski over and over again. And so, as I thought on this issue and on so many other issues, you know, how do we get, you know, someone from Yakima? How do we make sure that we have representation that speaks to the concerns of some of our members who are on the fence? You know, members who were uncertain. Some of them were folks who were really more likely to listen to doctors than patient advocates. You know, they were more likely to listen to labor unions than you know, unincorporated grassroots organizers. How do we make sure that we are sending the right messenger to each of our colleagues? And you know this work, and it works the same way no matter what issue we're focusing on. But this is, I think this is about relationships, and this is about telling those personal patient stories, those stories from our communities over and over and over until we convince everyone.
Nicole Macri, you mentioned about a report that came out just last week. And could you tell us how to access that? How can we read that?
I'm glad to send out the link to that, but it is the Washington State Institute of Public Policy, WISP. They did a two-part study. They did an interim study which came out in December, and then they had a directive from the legislature to come out with a final study, which by June, which they did. So they just came out with that, and it is looking at universal healthcare models. So both proposed models in the United States, which they covered in the previous report, as well as differences in a variety of universal healthcare models that are in practice around the world, and potential lessons learned that can be applied here in Washington State. So there have been similar studies in the past and literature reviews. This one, it has new information, and since the Medicare for All movement has really been growing, particularly since the 2016 election cycle, there's some new evidence about universal healthcare strategies that are in this report that I hadn't seen before. So I found it to be valuable. I still have more to read on it though.
So I wanted to bring up the affordability of health insurance. And I know in the Cascade Care bill, there is a provision to develop a plan to improve affordability for people under 500% of the federal poverty level. And I'm just wondering whether there has been any movement or you have any sense of how that is going to move forward. It's 3 agencies, I think, are involved in that, but we would like to see, of course, public input and continued momentum on that score as well.
Thank you, Janet. Thank you for the question. And by the way, thank you for all the times you testified, Janet, before us. You testified on a number of things and have done a great job, so thank you for that. We knew that the bill itself was going to be tricky and controversial in and of itself, which it ended up being in the end. And so we basically kicked the idea of the premium subsidy plan to be developed for future legislature, for future legislature to consider. So they're going to come up with a plan for premium subsidies. They're going to make a recommendation to us, and then we can go back and look at that. I would note today, some of you may have seen the story that was in the paper, but good news is good news. The plans, the rate filings that came in on the exchange-based plans were, I think, just an increase of 1%, which was the lowest in recent memory. It had gone up dramatically, probably in total at least 30 to 40% just since Trump came in because of his stupid policies. So that's good. There's also a couple of new players that have come into play. So that's interesting. I need to find out more about why, what seems to have stabilized, at least at the moment. But even from this level, one of the drivers of the plan of this concept of trying to stabilize the individual market is that you have people not only who are subsidized, but then those who may be just outside the subsidy window. We met, all of us have constituents who've met many of them who are, consultants, or they're independent, or they're in between jobs, or whatever it might be. And they're paying huge premiums and huge deductibles, essentially huge premiums for what amounts to catastrophic insurance. Right. The interesting point about this bill, and I used this when we talked about it quite a bit, something like, I believe 45% of the people in the individual market have a deductible structure in their plan of over $6,000. And even a percentage of that is even up to $9,000. So essentially you've got people, that's a lot of money. So you're paying all this out of pocket before your insurance even kicks in, and you're paying very high premiums. So we're trying to get at that eventually, and so the premium subsidy structure might be one way to do it. We hope that the plan itself will drive down premiums as well.
And just a couple more things to do. One thing, Nathan dropped off in front of everybody a Healthcare is Human Right campaign organizational commitment form. I just want to say a quick word about that. As you see, the purpose of this campaign is to secure the fundamental right to health care of all individuals, and we want to work on that both at the federal level and the state level, which makes us a little bit unique as a campaign, because most people engaged in this work are working on one or the other level. We want to combine them. We want to build a much stronger grassroots movement over the next year and a half. We want to strengthen our engagement with labor, with communities of color, with the immigrant community, with youth, and across the state. And Zoom is a step in that direction. But the reason I'm saying this is that a number of the organizations represented here have been either sponsoring or endorsing members of Healthcare is a Human Right. A number of organizations here have not even been asked to do that in the frenzy of the last couple of years. And so we want to encourage all the organizations here to take this form back to your folks, look at it again, re-up if you're already a sponsoring organization. If you're an endorsing organization, think about stepping up. If you've just been a campaign ally, the point is that when the structure of this Healthcare is Human Right campaign requires that in order to have a vote in policy decisions, you have to be in an organization that is a sponsoring member organization, and it describes that here. The member organization, which makes an investment of either time, volunteer time, staff time, or financial support. We need all of that. So I'm just saying, when we have our brainstorming general meeting on July 10, we're hoping out of that to reform a policy committee and other committees, and we're hoping that more of the organizations around the table here will become directly involved. So please take a look at that. Now, Kelly wanted to say a couple of words about how we're trying to improve our communications program so that we can do a better job staying in touch with you and getting things done.
Well, I'm pumped, and I hope you are too, about the allies in the room, the healthcare champion legislators with us today and in Olympia, and the momentum that we have built together this last session. It's incredible. Healthcare is a Human Right will be reconvening teams or committees later this summer so that we can capitalize on this momentum to achieve universal healthcare. That is our aim, that is our goal. I'm here to talk to you about the communications team that we're restarting, and we have an incredible example of the work we'd like to continue working on. This is a film from D.W. Clark, a Healthcare for All Washington board member and former Como TV video guy. He's one of our board members in Spokane, so we work across the state. And he has filmed this Dr. Lantsberger, a physician in Spokane, Washington. Can we play that video now? And I think there's a link provided for people on Zoom to watch it in a more friendly, Zoom-friendly way.
I'm Dr. Paula Lantsberger. I want to talk to you today about the deathly consequences for Washington families when they don't have access to health care. I had a 32-year-old patient who lost her health care insurance because she had an injury on her job. She couldn't afford her asthma inhalers for her lifelong asthma because the inhalers now cost $70. She couldn't afford an ambulance ride of $800 to the emergency department because that would make her homeless. She certainly couldn't afford thousands of dollars worth of emergency room care to go in for treating an asthma flare. It was spring. Her asthma flared up, and she waited at home as long as she could. In desperation, she called her brother to take her to the emergency department. After fighting traffic for 45 minutes, he arrived at his sister's house to watch her walk from the front door to the driveway and collapse and die in her own driveway. This was an absolutely preventable death from a 100% treatable condition, but only if you have health insurance. I had another patient tell me of his young wife's death from breast cancer. She refused to have it treated because she wasn't going to make her family homeless and force her husband into bankruptcy to afford cancer treatment without health insurance. I volunteered as the medical director for Project Access for the Spokane County Medical Society. This was a charitable program that provided free medical care for people who were within 200% of the poverty line. These people were desperate for care. They had conditions like brain tumors, blinding cataracts, huge herniated discs, breast cancer, and others. Prior to the Affordable Care Act, we had over 100 people applying every single month for the donated charity health care. After the Affordable Care Act, that dropped to less than 4 people a month seeking care. People had real health care, and they didn't have to beg for charity. Washington State has the chance to lead the nation and provide a basic human necessity, which is healthcare. I never want to see another patient die from a 100% preventable condition. No one should sacrifice their lives so that their family doesn't become homeless and bankrupt from the cost of medical care. Now is the time for our legislature to pass affordable health care, and now is the time for you to contact your legislator. Tell them now is the time for health care in Washington State. I insist that we fight for health care for all.
Yeah. So you can see that this heartbreaking video captures one aspect of the impact on Washingtonians, but we know there's a lot more stories, and our communications team really wants to delve into that and push out at least one a month to get out to people. And I just wanted to say that we would like to have a more robust website, blog, Facebook, Twitter accounts. We want to do it all. There's even some database work. So in the spirit of many hands make light work, we hope that you'll join us and help divvy up that work and have a kick-butt communications team. Thanks very much.
All right, well, thanks again to our healthcare champions, the legislators who joined us this evening. And to everybody who made their success in the legislature possible. So guys, let's keep in touch.